let's get straight to our top story. Now, you know that we have been tracking the COVID data very, very closely right here on ET Now and the India Development Debate right through this year and the very many months. Data never lies, and when the data has been worrisome, we've talked about it. When it's looked good, we're talking about it. The data now indicates a steady decline in daily active cases. Now, this is a very important parameter because it also talks to how much the disease is spreading and are we able to contain. You now have most of the new cases coming in only from 10 states. Of these, Kerala and Maharashtra continue to top it, but recovery rates over here are also high. India's active cases are below 4 lakh and the new daily cases have stayed below 30,000, and that's been a steady pace. Remember, in September this year, we were hitting close to a lakh new daily cases. That has consistently come down and it has stayed down. It's time to ask a question that is on everyone's mind. Is India somehow miraculously, possibly in a position to avoid the dreaded second wave of COVID-19 that has been sweeping the world over? It's an important question because it impacts not only, of course, the health of a nation, lives of people, but it also impacts the way the economy responds, the way that businesses open up, and the confidence that people have that things will get better possibly. To speak more on this, I'm joined today by Dr. Ambarish Dutta, who is an epidemiologist. He is additional professor epidemiology at the Indian Institute of Public Health. I'm speaking with Dr. Shashank Joshi, who is the Dean of the Indian College of Physicians, and Sangeeta Reddy, President of FICCI and JMD of Apollo Hospitals Group, is also on the show. Welcome to all of you and thank you for speaking with us today. Dr. Datta, let me begin with your take. Is it audacious to even ask the question of whether India will somehow bypass a second COVID wave? What do you make of the consistent drop in new daily cases? How significant is that piece of data?
Oh, it's very encouraging, and it's very likely that we probably had averted the dreaded so-called second phase, the second surge in cases. Having said that, you were talking about the gradual decline and also the steady decline and maintaining it around 30,000, even below that for many days. Another very encouraging figure that I would point towards is the death figure. Death never lies. Not only, you might miss out on cases, but people dying of a pandemic cannot be hidden. And the hospitalization and the deaths have really come down from its peak in September and early October, what we had seen all over the country. It has really come down, so this is quite encouraging. But at the same time, I would definitely make everybody aware that this had been witnessed by the European nations as well. And they then saw the surge because they put their guards down. We still have a lot to cover before a large chunk of the population gets vaccinated by a very efficacious vaccine. Till then, we cannot let our guards down, however encouraged we might feel. So those three things, social distancing and sanitization and masking, are very much the order of the day.
No, absolutely. That goes without saying. Dr. Joshi, I would argue that the guard was never up. We've spoken about this many times and it's not a good thing. But considering that there hasn't been any major compliance, largely speaking, and then you are still seeing a consistent drop in daily active cases. How do you put those two things together? It's not as if the general public has been very, very, clear and careful about masking or social distancing. We've all seen proof of that. In fact, we've come to a stage where different states are penalizing people for not wearing masks. But the fact is that the numbers are going down, the death numbers are going down. Can we see some kind of herd immunity building up? Or is it that the fact that we have a younger population has kicked in as an advantage?
So I think, Tamanna, I want to be very cautious here. And I don't think I like to use that word herd immunity. I think I would continue what Dr. Ambarish Dutta started. And I want to give you some 3-4 very interesting insights. Clearly, we are seeing numbers going down, but we have a December, January, and February yet to go. So we have 3 very crucial months with a very unpredictable winter, with the IMD predicting some low dip of temperatures, bad pollution still to come. Number 2, yes, I agree that COVID appropriate behavior has not been at its best, but definitely masking has improved, but the death numbers don't lie. So in spots and geographies where the antibody prevalence has gone above 60%, and there are such spots in Mumbai and Pune for sure, I can tell you, there probably is some degree of so-called, protection. So I would not use the word herd immunity because that's a very controversial and crazy term to use. But there is definitely a feeling there that the community there is probably handling this better. The most insightful thing is that though the numbers have come down, we are seeing a 80-20 or a 70-30 way the cases are coming in. They are predominantly coming in, and 70 to 80% of cases are coming due to social gatherings like marriages. And I don't want to pinpoint marriages here in a big way, but social gatherings and crowded clusters with poorly ventilated environments. And that's where a lot of the bulk of the cases are coming now. Even that can be mitigated. And I think it's premature to say that we have beaten the second wave. We are likely to beat it. And we may have a little better innate immunity. We might have, in at least a category of some spots of geographies, acquired some degree of immunity. For example, I can be reasonably certain that in some slums of Mumbai and some parts of Pune, at least from this geography, there's a likelihood of some immune status developing. The exposure at least is at least 60, 70, 80% in some of these places. So clearly that's coming up. And I think we should never have left our guard down. Our guard is still down, but it's better than before, Tamanna. I must admit that there's better masking. I'm not so sure about the distancing. And I think sanitization definitely is there. So I think overall, I think we should not all the time, beat up the citizens saying that they are not doing well. They could do better. And I think we are seeing an upward movement there. I still feel that, the numbers talk, and I agree with Dr. Datta that death talks. And case fatality rate is clearly down. I mean, no question asked that. And that can't lie. Those numbers can't lie. And critically ill situations, definitely we see a decline there. But we still have a harsh winter in some geographies of India. India is a very heterogeneous country. Different parts of India have different seasons, different behavioral patterns, different ways. And we have a Christmas and New Year coming up. If we avoid overcrowding, clustering, poorly ventilated environment, particularly which is polluted, between mid-December to mid-January, I think probably we might do better than Europe and US. And I think we have an opportunity here to do that. And I think we should live up to that.
Yeah.
And I think the citizens need to cooperate, but that's a challenge. But I still feel that we have a hope. But as I said, I'm cautiously optimistic. I'm not as optimistic as Dr. Datta is, but I hope that we can beat the curve.
No, absolutely.
Yeah.
No, look, we're in no position to declare that, COVID is going. No one in the world is going to do that. We're not trying to do that either. That would be irresponsible at the most. But Dr. Reddy, what is your take looking at the data? Because, there's one school of thought that is also attributing India's lowered daily active cases to a change in testing pattern, to more antigen testing or lesser testing, or lesser robust testing, if I may put it that way, which seems to indicate that we are perhaps not detecting as many cases as before.
So Tamanna, I think that when things are going right, people are pointing in directions of reasons why they're going right or why, they're not right. But the fact is that by a combination of reasons, the fact that we had an extensive lockdown and therefore had time to prepare, the fact that public are actually well educated, and I do agree with Ambarish as well as Dr. Joshi, that public are being extremely careful, except in these few pockets that are, kind of shown up here and there on the media. But if you, the last 1 week I've been in Delhi, And everywhere I've been, whether it's in the office, not just the hospital, but if you step into a mall, but every street, my driver will tell me, make sure you're wearing your mask, ma'am, because the police are checking. So this level of awareness has contributed to a dip in the numbers, and we should be positive about the fact that India can implement public level behavior change. India can implement safety measures. And I hope these lessons learned can be reused in other scenarios later. So that's point number one. The second point on the antigen testing. See, the fact is that, yes, we are doing a lot of antigen testing. But even then, the antigen testing, it is estimated that at the worst, there is a 20% missing of some test which could go positive in RT-PCR. So even if you take that number, we are still much below the mark, and the curve is definitely being flattened. So the important factors are keep up the guard. And now the time is to start planning for the vaccine. Let us celebrate once again the fact that our scientists and our pharmaceutical companies have done an outstanding job. The process of manufacture is one, but the entire challenge of administering. I mean, it's estimated that India will need 1 lakh healthcare professionals as inoculators. The government is doing some tremendous work in terms of planning. 30 crore people identified as the government's phase one. And then it goes on to, the planning of 2 doses, time lag between the doses, what is the IT backup to enable an efficient usage and administration, how are we going to indicate to customers or to pay, individuals of the population when to come, and most significantly, prioritization based on comorbidities, on age factor and healthcare workers. So all this is a tremendous exercise, which I believe is being very well planned, and it's time for us to start getting into that thought process. So keep up the guard, continue to celebrate the healthcare workers, both public and private, for keeping the death rate low, and then start planning for the vaccine. That's the phase we should be in.
Also, to jump in with just one,
I think a very important point you've made. Yes, Dr. Dutta, do come in.
Yeah, I mean, just you have said that the guard was never up. Maybe we never had that ideal, the public health prescribed behavior that the mass would expected to do. But just look at how we tided over the festivities. You had Ganesh festival in Mumbai and Maharashtra, and just look at the Durga Puja festival in Calcutta and West Bengal. The muted celebration by the mass definitely speaks volumes about the awareness of the mass about the pandemic. Yes, there are pockets where people had behaved recklessly, they were not very responsible. But as a nation of 1.3 billion people, I mean, many celebrations. I mean, look at what US had done during the Thanksgiving. I mean, millions and millions of people traveled by air, and Dr. Fauci was on air yesterday saying that it has just seeded the third surge in US, and it's going to come in another 10, 15 days. But look at the festival. I mean, the way we celebrated our festivals during the pandemic. Yeah. Maybe we are not very.
I completely agree with Dr. Dutta. We should acknowledge the tremendous.
And in fact, we should.
Absolutely.
Yeah.
But again,
just
we should not let our guards down. Christmas and New Year, we should be.
And the point you made. Yes, no, and even the point that Sangeeta Reddy made about Delhi. Delhi was looking like it was in a bad shape post the festive season. The guard had slipped, but then they have retraced, they have retracted, and people have become careful. So there is a clear causality between better behavior and of course better numbers as well. Let's just get a quick word on the vaccine. Dr. Joshi, I just want to get a quick word from you on the vaccine. Is the vaccine going to be the panacea of all of our problems? People are waiting for the vaccine, imagining that the day it comes and starts rolling out, the masks will be off and everything will go back to normal.
I think absolutely not. I think all my panelists, both Dr. Dutta and Dr. Reddy, will agree with me. That's not the panacea. Vaccine is just going to give us some little bit of extra security. That's about it. Let's be very, very transparent. Vaccine is very much there. India will be one of the first nations on planet Earth to have a very efficient vaccination program in 2021 and 2022. Mind you, it's going to take a long time. It's going to be a protracted effort. Which vaccine, how safe it is, how effective it is, how the chain of transmission will work out. Niti Aayog, Dr. Paul and their team have done an absolutely fantastic job. You will see it being unrolled in a very mindful, calibrated way. But we will have to mask ourselves all of 2021. Let me be very transparent here. And I might sound extremely crazy here, but I think it's very clear that we'll have to mask 2021. I don't know about 2022, but I think COVID appropriate behavior will have to stay independent of the vaccine. Also, mind you, vaccine will start from a very focused group. It will start from the most deserving people who are the COVID frontline, whether they are healthcare workers or non-healthcare workers. Then it will percolate to the senior citizens and the vulnerable population with comorbidities. Then it will go to the middle-aged population. Then it will go to the rest of the population. And when a critical mass of so-called that herd immunity comes in, probably that would be where it will stop. We also don't know whether it's going to be 1 dose or 2 dose. We don't know whether it's going to be an mRNA or whether it's going to be a live attenuated vaccine or whether it's going to be an inactivated vaccine. The good thing is we have so many options in India, which even US doesn't have. Okay, we have in India two vaccines which are excellent. One from Bharat Biotech, and I have known them very well for a long time, inactivated vaccine. One from Zydus Cadila, DNA vaccine, very difficult to make. Again, Zydus Cadila, known them very well. They are really doing a commendable job with our DBT and ICMR. They are right up the pecking order. They're in their phase 3. They might take 2-3 months. Then we have Serum Institute, which makes half of world's vaccines, which have almost rolled out the Oxford vaccine. And we might have 3-4 other people who might just spring up from nowhere. We might have an mRNA from Pune. We might have something else coming up from Bharat Biotech as a nasal spray. We don't know. So I think...
And one more from Hyderabad, Dr. Joshi. And one more from Hyderabad.
Yeah, I know. There's one more vaccine and biologically ones. And so many of them. So I think we should be very proud of our vaccine production heritage. And I think a large Indian population will get the vaccine. But I think it's going to be a very slow and calibrated response. So I think...
Dr. Reddy, I have to ask you...
Yeah.
No, absolutely. Absolutely. And in fact, there's no rush. The UK has rolled out its first set of vaccinations today. Lovely pictures of a 90-year-old lady and a gentleman in his 80s called William Shakespeare, both being the first and second people to take the vaccine. India is, of course, mulling its approval process, and we need not be in any rush. Dr. Reddy, I have a slightly different sort of question for you, and look at it from a business strategy point of view. Do you think we will be in a situation where a lot of companies that have bet on the vaccine will find that there isn't that much demand for it maybe a year from now?
So honestly, Tamanna, I don't think so at all. Because like Dr. Joshi was saying, if you actually look at the numbers, it is 30 crore people in India in phase 1 and then 50 crore people in phase 2. It's estimated that this will be about 30% of the production capacity of the Indian manufacturers, which they will need to keep in India, and the rest they will be exporting. I don't believe that there is any government or any individual who will say we don't believe in wide-scale vaccination. That's point number one. The second point is that most likely all these vaccines will require 2 doses within the time gap of 2 to 3 weeks. And the next point is that it's estimated that post a year, 18 months or 24 months, you will need to get revaccinated. And all these are emerging aspects of the science. The other aspect is that the virus is something which now we are continuing to see more and more of. So the capability, the knowledge and the science which has been deployed for the COVID is a capability which will be used across multiple other viruses. So number one, I think the first 6 months will be a period of high demand and shortage of supply. The next 6 months, demand and supply may match each other. 12 months from now, we may possibly see that there is more supply than demand. But this is the next phase, by which time we will understand the revaccination cycle. So I believe that everyone who has rushed to make the vaccine has done so appropriately. And by the combination of serve India as well as serve the world, it will also be financially very viable for them.
Exciting times coming up, but at least today we can say that our numbers are looking good. These are important numbers, they're looking good, and yes, if you mask up, they will keep improving. Let's not mess it up now, since we have had a consistent improvement in daily active cases. That's the big message coming from the experts. Thank you so much to all of you for joining us on the lead story this evening.